Tonight we continue our week-long Zero Suicide Initiative coverage with a goal to end suicide in Kern County. Behavioral Health and Recovery Services is employing the help of peer navigators, a special mentor for those struggling.
And these peer navigators use their own life experiments to help people going through the same battles they did. Eyewitness News reporter Lexi Wilson shows us how empathy is one of the keys to zero suicide. Lexi.
That's right, Dave and Rochelle. Peer navigators are people in recovery from mental illnesses or substance abuse. While for many suicide is hard to talk about, these navigators are open to it because they've gone through it too. Depression, anxiety, alcoholism, homelessness can all be overwhelming. Many people go through it alone, but you don't have to.
Peers really do a great job of connecting with people because of that level of experience that they have. They can empathize with a client who feels like nobody's listening to them. Jeffrey Kaya is the supervisor of the self-empowerment team at Kern Behavioral Health and Recovery Services. He says peer navigation was established to ensure people don't fall through the cracks, especially those with suicidal thoughts. They develop that relationship in order to demonstrate to the clients that we completely understand what they're going through and that we're going to get them to the services that they need. A peer navigator is more than a counselor. They're a former patient, so they're not afraid to talk about suicide and want to use their experience to support you.
I'm a suicide attempt survivor. Over the course of my life, I'm in recovery from a major mental illness.
Jamie Garcia is the administrator for the Recovery Supports Division at Kern Behavioral Health. When she was a teenager, she tried to kill herself.
I'm so grateful that I never completed a suicide. I would have missed a wonderful life, a wonderful career, a wonderful experience with my family.
Now, Garcia uses her story to save others.
I am able to connect with people, and I think a lot of it has partly just because I don't come off like a clinician. I ask people permission. You know, I have some experience with suicide attempts. Do you want me to tell you about it? And ask their permission, and almost everybody does.
It takes just one person to listen, to care, to not judge. That can save a life.
No matter how bad you can feel and how severe the illness is and how long it lasts, that you can still make it through alive.
Peer navigators provide positive change and understanding. They create hope and let people know there is a future to look forward to, and it's working.
That it's just about making a human and genuine positive connection with someone that's suffering, and that you can affirm that person, validate their experience, but also let them know gently that there's hope and that they're going to get better.
To get in contact with a peer navigator, you can reach out to the Consumer Family Learning Center at the number on your screen. These peer navigators want to get to know you and are here to help. At BakersfieldNow.com, we have a full list of resources and how you can get connected. Reporting live in studio, Lexi Wilson, Eyewitness News.